Remember the last time NHS nurses went on a national strike? You don't? Well, that shouldn't come as a surprise since it's never happened before, not once in the 106-year history of the Royal College of Nurses. That is, until now, because the RCN, the trade union for nurses, is organising strikes which could start before Christmas and continue well into next year. Across the UK, 311 hospitals, trusts and health boards were balloted to take action, and more than half voted in favour, making the threshold. Now, plenty of people in Britain are going on strike. After all, high inflation means virtually everyone is getting poorer. Train and bus drivers, postal workers, BT engineers, civil servants and teachers, to name a few. But unlike those industries, a national strike of nurses would be entirely without precedent. So why are nurses going on strike? Why the sudden militancy from the Royal College of Nurses, an organisation which didn't even support the idea of industrial action until 1995? The simple answer is they've had enough of getting poorer. Their pay has been falling in real terms for more than a decade, and they know that's all the future has to offer too. Since 2010, nurses have seen their real pay fall by more than 10%. That means their wages now buy 10% less stuff than 12 years ago. This has happened alongside underfunding in the organisation, leaving nurses overworked, exhausted and demoralised. Basically, more work under more demanding conditions, but you're paid less. It's no surprise, then, that not only are many nurses leaving the NHS, 40,000 last year, at the highest level in a decade, but recruitment is a mess. Today, there are a staggering 47,000 nursing vacancies in England alone. That's more than 1 in 10 roles left unfilled. We're constantly reminded of waiting times for treatment in the NHS getting worse, and according to NHS chiefs, this is the main reason why patients are waiting so long in A&E and for things like cancer treatment. According to the Royal College of Nurses, just a quarter of shifts have the planned number of nurses present. 1 in 4 are properly staffed. Fewer than 1 in 5 nurses say they have enough time to provide the level of care they want. Now, that's hardly a surprise, is it? Imagine if you were a football team and 3 out of every 4 games you were forced to play with 10 players. You'd have to give 110% just to stand still, and most of the time you'd still lose anyway. That's basically the NHS. The situation is so bad that since 2017, 50,000 nurses who've registered to practice in the UK were trained in countries that have too few nurses of their own to provide the standard of healthcare recommended by the UN. Because we don't pay nurses enough in the UK to stay in the job, we increasingly depend on recruiting nurses from places like Ghana, Nigeria and Nepal, despite the World Health Organization discouraging international recruitment from all 3 countries. And even then, after that, we still have a massive shortfall. Now, this year, the government accepted the recommendations of the NHS pay review body and awarded a pay rise of at least £1,400 to 1 million NHS staff. £1,400. That sounds quite reasonable, doesn't it? Well, in the context of what is happening with inflation, not really. For a newly qualified nurse, £1,400 represents a pay rise of about 5%. For more experienced nurses, it's close to 3 or 4%. But given inflation is expected to be 9% for the whole of 2022, it's presently about 11 or 12%, that actually means nurses are getting poorer, maybe by as much as 6% just for this year. Now, bear in mind, they were already 10% poorer since 2010. But it doesn't end there, because the government now plans to cap public sector pay rises at 2% in 2023. Meanwhile, the Office for Budget Responsibility recently forecast inflation for next year at 7.4%, meaning nurses will be another 5.4% poorer. So in just 2 years, nurses could become 10% poorer. Their wages will buy 10% less stuff. And they'll be at least 20% poorer compared to 2010. It's no surprise then that 6 NHS trusts have set up food banks or voucher schemes to help staff with the cost of living. You'd think having food banks at work would be a sign that you need to pay your staff more. Apparently not. Now, a newly qualified nurse can expect to earn £27,000. That rises to over £30,000 for London. This comes after 3 years of study, 2,000 hours of hands-on clinical practice, and taking out, on average, £54,000 of student debt, plus interest, of course. So here's the trade. Come and get £54,000 of debt for a job which will pay less in real terms every year, where you'll be emotionally and physically drained, and where you may even need to use a food bank. Oh, and in bigger cities, half your wages will go to a landlord. Do we have a deal? Now, amazingly, it doesn't even end there. because the government's proposed reforms for student finance, which come into effect next year, leave nursing graduates amongst those hardest hit. But at least graduates who go straight into high-earning jobs like finance and who don't have to take time out to look after kids will benefit. That's the important thing, isn't it? Society hasn't put those kinds of people first for too long. Nurses have had it way too easy. By the way, if you think I'm joking, in the months to come, much of the mainstream media will perform a handbrake turn. You will hear that kind of rhetoric all of the time. We will be told that the nurses who we applauded and who kids made posters about during the pandemic are actually public enemy number one. They're work shy. They're the enemy within. They don't pull their weight. Mark my words, you'll hear all of that and more. Now, while these strikes were being voted on, NHS England announced it was going to do a recruitment drive to address nursing shortages. At the centre of that will be a We Are the NHS ad campaign to portray nursing as a fulfilling role that changes people's lives. Sorry, we can't guarantee pay that keeps up with inflation and you'll be paying off debt for 40 years, but how about a little clap? Maybe at Christmas they'll get a pat on the head and a mince pie too. But here's a thought. Rather than the taxpayer paying for an advert that makes the NHS seem like Love Actually, which seemingly happens every year now, why not put that money towards actually improving their wages? Just a thought. Clearly, this is an absurd way to run things, particularly given nursing is a job which society needs to function. The Minister of State for Health, Tory MP Robert Jenrick, recently said himself that, quote, nurses play an integral role in our society. I agree. And that's precisely why the RCN is demanding a pay rise of inflation plus 5%. Right now, because inflation is high, that would mean a pay increase of 16%. Now that sounds like a lot, doesn't it? Those greedy nurses not wanting to get poorer every year, how dare they? But remember, that would still leave them considerably worse off than in 2010. But apparently, having pay levels slightly lower than 12 years ago is a wild utopian dream. Whatever next? Being able to buy your own home? Billionaires paying their taxes? Don't be so childishly naive. In response, the government says that would cost £9 billion. Again, that sounds like quite a lot, until you remember that the total wealth of billionaires in the UK increased by £106 billion during the COVID pandemic. The richest 10% of households gained an average £51,000 each, 10%. $9 billion versus $106 billion. You can't say the money isn't there because it clearly is. Nurses are some of the most important workers in Britain, and the reality is the NHS is losing them to such an extent that it's constantly on the edge of collapse. And no, that isn't me being melodramatic. There is presently a backlog of 7 million patients waiting for treatment. The average waiting time for an ambulance is an hour. And in a recent survey, 1 in 3 ambulance staff said they'd been involved in a delay which resulted in a person dying. None of these appalling issues can be addressed until the NHS has more nurses. And it can't get those nurses and keep them until it pays them more. There is no third option here, regardless of whatever ad campaigns some marketing exec cooks up. The government can meet the Royal College of Nurses' demands, which still leaves them poorer than 2010 by the way, or allow the NHS to continue to collapse. Those are the stakes, which means it's not just nurses that need their wage demands met, it's the rest of us too.